You two have had several discussions about safety, managing risks in the operating room, and the similarities to how astronauts and their support teams approach risk management in space. So tell us about those conversations. Tell us about how you've, in the past, compared the two.
So, one of the things I began to realize as Sandra and I talked about this, if you think about an operation like a mission, right, the steps are kind of the same. You've got to have the training, you've got to have the place in the support team to do it. Um, but where the analogy stops then is a single flight to space is a mission that takes years and years and years and is a one time thing. Whereas, even though we have kind of the same structure of how we train and prepare and look for issues that might happen that were the unexpected things, we're doing it 10 times a day sometimes. And so it's a magnitude of difference in terms of the danger, first of all, but also the complexity. And so similar, but not.
Yeah, you remember some of our conversations, just to pull on that thread, was about the, like the dynamics in mission control versus the dynamics in an operating room and having very clear roles and responsibilities and procedures. So we came up with a lot of parallels there, I think.
Yeah, there were, I think the in the operating room, it really is a team, and it's much more of a team now than it was when I first started training. When I first started training, there was the surgeon who was in charge, and now it's much, much more of a team. And I think that's kind of the same analogy when you have the people in mission control who are providing all of the support in a very active way is a lot like the anesthesiologist and the nurses and the people that are providing the instruments. And even, some of the very highly technical instruments need to have experts that come in and help us troubleshoot them and do things. So that's the similarity, I think.
I would think that there's another similarity. When you light off the rockets, the solid boosters and that thing starts to leave the pad, there's no going back. And when you get out there, if something goes wrong with your spacecraft, you're kind of on your own. You got to fix it. And I would imagine the same thing's true in an operating room. Once the incision is made and you're deeply into the operation and you find something you didn't expect, it's not like, oh, I want to just go start over on this thing, or I want to call in some other people here. I guess you could do that, but I mean, there's sort of that stepping off the cliff aspect, I would think, to both of them.
Yeah, and I think that when I was talking about the trauma surgeons earlier, I think that that's the group of people, and for all of us in the middle of the night, if there's, somebody who's been shot or in a horrible car accident, and you open and it's a disaster, that really is that moment of adrenaline that you have to learn how to manage, and you have to get out of that situation.
So how do you manage that kind of adrenaline in the middle of an operation?
One of the things, I actually taught this out loud, and that no one ever taught me this, but I would watch people I was working with. And, when you're first starting, that adrenaline is there when you're learning how to make a skin incision, And what happens is their shoulders go up to their ears and they start breathing fast. And I actually would start telling them, look, you have just totally launched your sympathetic nervous system, and that is going to completely block your ability to think and do things. So I want you to lower your shoulders and take 3 deep breaths and watch what happens. And it works every single time. What happens with time is you begin to channel it more, and you learn automatically how to control it so that you're not, trembling and having all of the force of adrenaline behind the decisions you're making and what you're actually doing.
And you recognize when it's happening.
Yeah, I was going to say, that's key,
Right.
to know when it's happening.
Exactly.